The I Mold You So podcast with Katie Buckland Weiss.
Hello, everyone, and welcome to this week's episode of I Mold You So with Katie Buckland Weiss. I am so excited today. As my podcast has continued to grow, I've had wonderful physicians join, family nurse practitioners, experts in the space, and today is no exception to that. I am joined by special guest Dr. Diana Stafford, widely known as the Detox Doc, and that's how I came across you, Diana. So glad to have you here today. You are a functional medicine doctor and author of Conquering Mold, How Mold is Making You Sick and How to Heal. And I am picking up what you are putting down and can't wait to share all of the information and insight you have with our listeners. Through Diana's Detox brand, their Detox Doc brand rather, she leads a vibrant online community, teaches transformative programs, and guides clients through deeply personalized healing journeys, which is so important, the personalization of it. Of course, you have a strong social media presence. That's how I came across you. And you inspire others to detox their homes, bodies, and lives. I mean, it really is full circle. And you remind them that healing is always possible. And it's multifaceted too. So I can't wait to talk about that. Your approach bridges detoxification with cutting-edge gut health and toxin recovery work, helping people rebuild from the inside out. Wonderful.
Thank you so much.
Yeah, well, thank you so much for joining today. And before I have a load of questions for you, but can you just share with us, start us off, can you introduce yourself and tell listeners about your background and how you came to specialize in detoxification, mold, illness, and the environmental medicine that plays into this?
Thanks so much, Katie, again for having me. And yeah, if you told me 5 years ago even that I would be specializing in mold and gut and toxins, I probably would have laughed. It's not been my entire career by any means, but I'm so thankful that I am doing this now. So I'm a conventionally trained MD and I practiced regular medicine for several years. And so we got to the mold place by professional as well as personal experience. So personally, we had a mold exposure, as many people do, and knew that there was mold in our rental, didn't really think it could harm us so much. Settled for the landlord's cleaning
Mm,
protocol, painting over the mold.
mm,
Okay, it's hidden, it must be fine. But it wasn't. So we had two kids at the time. We have three now, but two of our kids lived in that home and we all developed different symptoms. My husband has a long-standing history of gut issues, and his gut issues flared up immensely in that house, as well as some neurological symptoms that he had.
wow. Okay.
I had some of the more invisible symptoms, more insomnia and the mental health issues, and I wrote those off due to various things, as is often done, especially in conventional medicine. I had my, other doctors check me and it's like, oh, everything's fine. It's just whatever stress. And
Mm,
then our toddler, he had a variety of different symptoms. He actually was wheezing. And so we did connect that part with the mole, but the rest we didn't, like rashes, fatigue as a toddler, which, if anyone listening to this is a parent and their kid as a toddler is tired, huge red flag. That is not the
okay.
norm. They should have endless energy. And then he had some other symptoms. My older daughter was an infant at the time and she was colicky. Like she wouldn't sleep well in the house. She had to be driven around. And so another huge red flag, if you have a kid like that, then it could be the environment if they're not sleeping well there. So we all have various symptoms. We moved because we were going to move anyway. It was a rental. And we got better, somewhat because of that, because moving out of the environment is key. However, we got a functional medicine workup for my husband, Andrew, because he wasn't getting better.
Hmm.
And part of that workup included the mycotoxins and organic acids and gut testing that I didn't use at the time, but I stand by now. And we got these results back. Everything's off the charts. And so that was just blindsided me. So I'm sitting here thinking, how did I not know about these tests as a doctor
Hmm.
who am primary care, testing people for a broad range of things. And this wasn't even on the list that I was taught to consider. And so I sort of felt betrayed by my medical education at that point. And I said, I really want to help people who are dealing with this. So I went and looked at the research, confirmed that, there's a lot of actual research and PubMed articles published on this, even though, doctors say, okay, I don't keep up. Didn't really have time to research all these extra things. But, once you really dive in, you kind of get in this mode of, really thinking, okay, this really should be on the list for primary care doctors and other doctors. So decided I wanted to help people with mold in some way, as well as gut health, because conventional medicine doesn't really take care of that very well anyway. And so it took a while to really figure out how that was going to look, because I tried to fit it into my group practice and it wasn't going to work, not because the other doctors weren't interested, but because of insurance and
Hmm.
administration, because they really run the show and doctors are just sort of cogs in the wheel of the system. So I decided that I wasn't going to do that anymore. And I couldn't stand in a system that wasn't helping people. I couldn't, sleep at night thinking that there were these diagnoses that I was straight up not able to help with because of the system that I worked in. So I got out of the system, and now for the past few years, I've been doing functional health, and I love what I do, helping people with gut health and mold, because they're so hand in hand, toxins and the gut
Hmm.
and other toxins. So it really is key to have all those pieces in there. So that's kind of the long and short of like personal and professional reasons of how I got into this space.
Well, I think it's so important, and I keep hearing again and again, and really, really the catalyst behind me starting I Mold You So is that it wasn't even on the list for the doctors. Even for my husband, who's family medicine, right? It was not even in the universe. Like, maybe this is mold, maybe this is environmental. And it was so wild because we were ruling everything else out, all the scans, everything. And I kept getting worse. So something was hurting us. Something else that you mentioned that I think is worth bringing back up is everyone had different symptoms. And my husband had a host of symptoms that were very different than my symptoms. Although he was sick, he was not bedridden like I was. Our little boy also had symptoms with, the fatigue. And then, I want to talk about this in a moment, but one of the things that my husband had was a constant clearing of his throat. And I keep hearing that. So I can't wait to get into the symptoms, really in an effort to raise awareness. If we're reaching people and the listeners are like, I'm so desperate for help. I'm sick, but I don't know what it is. I've been sick for years. Or for me, I had been exposed for 3 years, but really didn't fall sick until my mycotoxin level just the cup, filleth over. And I really want people to hear us to think, I have these 4 symptoms. Maybe I need to look at mold and what you recommend for your clients. So how would you describe mold illness to someone that has never heard of it? And what are the key concepts or definitions that you would rely on?
So for mold illness, it's really broad, because mold, we think, oh, it's mold on food or maybe mold outside. But what we really are focusing on when we talk about mold illness is mold in your home, which is often hidden. So you can have, exposures through food. It's important to note that, and from outdoor like allergens or things like that.
Hmm.
The major thing that we're talking about is mold that is, for example, behind the drywall or in the bathroom or things like that, like environmental mold exposure concentrated in the home.
Hmm.
So we see this mold, we think fuzzy mold, but it's not really that's the issue. It's the things that are invisible that mold puts off into the air that are microscopic, so we don't see them with the naked eye. So it's the mycotoxins, it's the VOCs, it's the fungal fragments. It is all of those things. And we say, mold illness or mycotoxins, which are mold toxins, but it's really all the things, chemical compounds that we're breathing in whenever we're exposed to mold, in addition to the other things that come with mold, which are like bacteria, which like to go with mold. So basically, it's invisible toxins in the air, variety of things put off by mold that we don't see, but that actually cause inflammation in the body. So, a concept that I would focus on is inflammation, because you may have heard, the listener, you guys may have heard of that from your doctor, like, oh, we checked your inflammation levels, like ESR or CRP or some blood work, and they were fine, maybe, or maybe they weren't. But then they don't really go down a line of like, why is that elevated or what may be causing this inflammation. It's just like broad term. But toxins cause inflammation. And that is a huge concept that your regular doctor is at this time pretty much going to miss. So, inflammation, what does that mean? It means that your brain being inflamed can cause things like brain fog, fatigue, irritability, unexplained behavior changes, thoughts, feelings, anywhere from that to like all the really intense symptoms we also see, things like hallucinations, things like we call mold rage, where it's like all of a sudden you're just raging, like you're
Yes.
angry, super, super angry, and you're like, that's not me. What just happened? Things like that. So, toxins can trigger these like inflammatory episodes as well. And then in the gut, I mean, over half of people in the world are dealing with gut issues. So, if you're
Hmm.
in the room with one other person right now, one of you has a gut issue or both. So, it could be that it's triggering inflammation in the gut. What does that look like? IBS. So many
Hmm.
people have this diagnosis and are wondering like, what does that even mean? How did I even get that? Like irritable bowel, okay? It can look like just bloating. It can look like food sensitivities that you didn't have before. So inflammation plays out in different ways in different body systems. But that is, I think, the biggest thing to remember is that it's not like, oh, this is a fuzzy mold on a piece of bread. I should probably throw that away. It's like these are the invisible toxins that we're breathing in every single day. If you have a significant mold exposure
Hmm.
in your home, work, school, car, gym, anywhere, and they're filling up your toxin bucket, even if you can't see it, and
Right.
your liver is going to have a hard time keeping up. 30% of adults in the world have fatty liver disease. Why is that? I think a huge reason is our toxin load that we're exposed to on a daily basis. We just can't keep up. It's not
Right.
mold toxins, chemicals, like all of these things add up. And if we don't realize that, then we're not able to minimize our exposure, which then will allow your body to do what it's supposed to do, which is detoxify on a daily basis and have these chemical reactions take place in the liver and everything else. But if it's too much, then you're going to get symptoms.
Right.
There's a lot I could say about that, but I think that those are the biggest things to remember is that if you feel inflamed, consider toxins.
Yeah, that's such a wonderful introduction to this. And people that might just be coming to this for the first time. Great recap. And as you talk through this, I think about when I look back, right, hindsight's 2020. And so I really fell apart in November of 2023. And I look back and I'm like, man, in October and September of 2023, I remember being at dinner and looking in the mirror in the bathroom and being like, I look 6 months pregnant. I was not 6 months pregnant. And just like, where did this come from? And the 6 months kind of leading up to what I'll say, like the onset of real physical chronic pain symptoms, my vision, I couldn't see, like my plate in front of me at dinner was always blurry. And I'm like, oh, well, I'm 40 now. Like, this is just 40. And I mean, it's just so wild. And I think it's important to talk about these things so people can kind of think, oh, well, I'm experiencing that. And look, when you turn 40, sure, like your vision could go. I know that's true for many people. For me, it was not. It was this inflammation that was happening in all parts of my body, all systems. Okay, so let's talk about in your work when patients first present, what types of patients do you see with mold issue? Is there a certain age or comorbidities that you see?
Yeah, so it can be any age. I work with kids to adults, all ages. And so even if you're healthy, even if you're, especially if you have other underlying medical issues, then the mold will kind of prey on your weaknesses and it will exacerbate or worsen what you've already got going on. So I see, yeah, I mean, a lot of like some of the major symptoms, just to kind of review what I've already mentioned, as well as add a few more, would be brain fog and fatigue. So, I mean, it's huge. Like I feel like so many people are just like in a fog these days. You're driving around and I'm like, a person's in a fog, clearly, for whatever reason, but it could be toxins and just this fatigue because of the toxin overload. And then you can't sleep, you're wired but tired, all of these things. People with hormone issues, a lot of times, any kind of hormone issue, a lot of times the toxins will be a part of that
Hmm.
because they can attack these hormone pathways all down the line, anywhere from like your thyroid hormone to your estrogen, your progesterone, any of that. It can mess them up. And then things like gut issues, we've touched on a bit as well, but huge. I mean, very, very common with mold. So, respiratory is not even the number one thing that I see. That's what people still associate with mold because of mold allergies causing
Okay.
respiratory symptoms, but it's not. The major symptom that I see of things like mold toxicity and pollination, that would be like more mold allergy. Things like sensitivities, or if you feel like you react to random things, then if you have mast cell issues, that's also strongly correlated with mold illness. I do see a lot of rashes. It's not one rash. I mean, I always get asked, what is the rash for mold? It's not one rash. It's like any kind of skin issue because toxins try to come out however they can. And sometimes that is through the skin. So your
Wow.
skin can get inflamed. It can just be like red. It can be itchy without a rash. You can feel like bugs are crawling on your skin. People send me pictures all the time, like, is this mold rash? And it's like, there's not one rash, but it can irritate your skin as well because your skin can also just be irritated by exposure to a high toxin load in the air. So I do think that the vision issues are very common and that falls under the umbrella of like neurologic symptoms a lot of times, which are extremely common. Anything from like dizziness and vertigo, which can be like an inner ear issue, but it can also be more neurologic, and then the visual symptoms, like you said, kind of blurry vision, or you're trying to drive and you're like, wait a second, why are my glasses not working? My prescription's always changing, and the eye doctor doesn't understand it. And things like that are really common. I mean, it can really do so many different things,
Yeah.
which is why people are listening, they're like, "Okay, well, I was taking notes, but now I don't even know what to write." Understandable. So, what I would say is take the mold symptom questionnaire that I have. So, I made over a couple years, I did statistically like what are the most common symptoms that I see, and I put them into a one-page questionnaire because it can get really overwhelming thinking, well, mold can do anything. Yes, it can, but there are some symptoms that are more common than others, like headache on the back of the head, or like some of these neurologic symptoms we've seen or talked about are more common than some others with mold. So you get a different score based on how often you have these different symptoms. And then you just add up your score, and then you can say, well, maybe it's not primarily mold, or maybe it is. And even if it isn't, then we got to figure out what it is. So that questionnaire is several different places, but on probably all the links that you'll put with this episode.
Yes, we will be sure to share that. And that is so important to mention because once I finally put the pieces together, really on my own by trial and error, that led me to understand I had mold illness and then confirm with my doctor, is realizing, hey, these are the symptoms. And if you have so many of them, we really probably need to look seriously at mold illness. So you talk about the GI issues, and I go back and I think to when I first had my onset. So I had a really deep pain on the left side of my rib cage. We initially thought kidney stone, but I was like, I've had kidney stones before. Like, this is not kidney stone. This is deeper. And I had a lot of neurological issues on the left side of my body. My left arm was retracted. I was dragging my left leg. But on top of that, I had what you just mentioned, I would tell my husband, it's like I have ants crawling in my skin. Like, that's the only way I can describe it. And people were talking about the ice prick pain or ice pick pain. I did not have that, but I had this chronic pain that kept me up all night, kept me up all day. As I've mentioned before, like morphine wouldn't help it. Nothing touched this sensation and this pain. But when it first started, I actually went to my GI doc because it was kind of like in my diaphragm. And I was kind of like thinking like, oh, this could be GI. And as I described it to him, he was actually like, I really don't think this is GI. Then, ultimately a year later, I did end up having a colonoscopy because I was just like, nothing is coming together. Like a week before we put the pieces together, I had a colonoscopy and they're like, colon looks fine, no problem. But what I learned is that a lot of these, and you can speak to this too, like the mycotoxins just breed in the GI tract. And so maybe we can talk a little bit about binders and how that plays a role there. But I'm going to put a pin in that and also talk about the optic piece of this and how I don't want this to come off as conventional medicine failed me, but I was the one that was able to put the pieces together. It was not a doctor, they were, you look good to me. The labs look fine. But I went to the eye doctor, and when he did the scope on my eye, he's like, your optic nerve doesn't look right. And he's like, I'm going to put you in the machine to double check this. Well, the machine looked at my optic nerve and they're like, oh, you're good. No problem. But when he was inspecting me, he was like, something doesn't look right. Well, fast forward, now I know that the optic nerve can be, highly affected by mycotoxins. And, when we go back to medicine basics, he's looking at it and he can tell something's wrong, but the machine didn't pick up on it. And now I know that, again, so many of my systems were affected by these mycotoxins. So that being said, everyone is a little bit different. Like, I really don't think that I had a lot of GI issues. I did become, if I'm being completely honest, obsessed with my stool because I'm like, this can tell you so much about everything. And really, there were stress factors that were playing into that, medicines I was on, GI map. So my husband actually did a GI map on me, and it came back that I had a protozoa. This was at the start of it. And I had a protozoa, and we treated me for the protozoa. But I actually, like 14 days later, I was like, this is not helping. I'm getting worse. So we did end up clearing the protozoa, but we weren't addressing the mold and mycotoxins because we didn't know. But for me, like my GI map came back with just a protozoa and everything else pretty much looked okay. So again, leading into that, like you might have problems here, but not here in this symptom. So um, so we've talked quite a bit about the symptoms and the symptom clusters, but because so many mold related symptoms overlap with other conditions, and I lived and breathed this, looking for MS, brain tumor, pituitary, all these things. How do you distinguish mold illness or mold driven illness from other causes?
Yeah, so that's it's so complex, I think. But for the listener, the important things are, I would say, exposure history. So if you come to me and you're saying I had a mold exposure and you've had a significant mold exposure and you have symptoms that correlate with that timing, do you have to have any sort of testing to say, okay, well, that mold probably affected you? No. It's like, well, if you had this huge toxic soup that you were breathing in for however much time, and you know that it affected you, then, I am going to help you even if you can't do testing or whatever. But so, how do I distinguish for sure whether there's mold illness? So, there's some testing that I do. So, on all my clients, ideally, I like to get 3 tests at least.
Okay.
There's mycotoxins or total toxin if they have concern for heavy metals or other environmental toxin exposure, live near a gas station or something,
Is that
or
a
have
urine test or blood test?
I usually use the urine one because
Okay.
it's just as accurate as the blood and it is easier.
Okay. Yes.
But they each tell you different information. And then the organic acids test or oat test, because that has the fungal colonization section, as well as it tells you about like your mitochondria and some other really useful information for detox. And then last one is a gut zoomer. So similar to the GI map, only it's even more comprehensive. It tests like some things that GI map doesn't test, which I like the GI map too, but um, gut zoomer checks for like butyrate level and some other things that are key to kind of just see and know. So that is really enlightening. Like you said, you can find parasites on there. You can
Hmm.
find how inflamed is your gut or not. You can find if you have candida colonization of the gut specifically. So all those 3 tests give me like 80 pages of information on what's going on with the person. And then, we can figure out maybe, what is more of a component versus less. So that will give me an idea whether there is mold toxins coming out in the urine. And what does that mean? That means it tells you what you've been exposed to and what your body is trying to clear right now. So ideally, that would be the same exact levels as in your body, but the only way to get a, 100% accurate explanation of the levels in your body, we would have to do a biopsy, which we don't do,
Right.
to get like tests for mycotoxins in tissues or things like that. But that is the only like direct test of mycotoxins is urine mycotoxins, but then blood tells you antibodies to mycotoxins. So those are the antibodies that your immune system has made due to being exposed to those toxins. So it's the two different kinds of antibodies. So you can kind of figure out what if is it more recent exposure or allergy, or is it more like a past exposure? And those are good if you know that you're a poor detoxer, like you have HLA-DR variants that are associated with not detoxifying mold well. So if you do happen to know that, then I would do the blood test instead. Genetic testing can be useful also in that case if we're finding like everything comes back negative, which is not super common, but it can happen that everything comes back and there's not a whole lot on there. And then I like to do genetic testing to see like what's the holdup or what's going on there. So I like to do that panel and that testing bundle on everybody if possible. So, but really the most important is to trust the symptoms and your history. So, as, any good doctor would say, the most important thing is a history, and it's like I went to one of the top med schools, but they didn't teach me that in this context. But we do say that, they do say that overall, it's like you should be able to diagnose somebody based on their history and their symptoms, and anything that you can see or they can describe to you on exam, because it's key to get the history.
Yeah. So I wonder, do you ever take in MTHFR into account with your patients?
Yeah, so I do, I don't focus as much on genetics as a lot of people do, because 90% of what happens in our daily life is due to epigenetics or changing the gene expression. So genetics are not your doom or your destiny. They're just like where you start off. And so once we take out what's in the way of your genes being expressed properly and allowing those chemical reactions that are supposed to take place in the body to actually proceed and add what needs to be added, then it's not genetics are not as important. However, yes, it is important because like it will help me make decisions on what supplements people may need or if they may need extra support,
Right.
or we can know like, oh, we are definitely going to need extra support because of this. And so, we shouldn't be frustrated whenever it takes longer to heal because of this. So a lot of it comes down to, you know, finances really, and how much testing people want to do. And yeah, but it is a useful piece for sure. I just try to keep people out of that mindset of like, oh, I have this gene with people, which people call the mold genes and stuff, which I don't agree with. But I don't like it when people stay in the mindset of like, I'm just doomed to never detox, like I can't heal.
Right.
So it's very easy to get in that mindset when you're super overwhelmed with this whole thing. But yeah, so I do get genetic testing. It's not like the first thing that I'll do though.
It's so encouraging to hear you say you can heal, because it is, especially when someone is sick and they're looking for answers and they're very desperate. And you get to this point where perhaps you confirm you have mold illness. Like all the tests are showing it, your symptoms, like everything, your history. We know what we're cooking with. There's still a long road ahead. And one of the things I appreciate so much that my physician shared with me was like, hey, initially give yourself 12 to 18 months. And I was like, I don't have 12 to 18 months, but that really helped manage my expectations and my healing, because for the first 3 months, and I did the shoemaker protocol. We'll talk about protocols in just a little bit, but I did the Shoemaker protocol, and, there's the pyramid building. And, for the first 3 months, so we remediated, and then ultimately we actually moved. So it was like a double blessing. But the first 3 months, I started a binder, I started doing this, I started some supplements, and I was hopeless because I wasn't getting any better. But I knew in my heart, because we had found the black mold in our home, like this is what is happening to me. And I have to trust this process. And, I love instant gratification, and I want to fix, and I'll take a pill. I'll run around as much as you need me to in order to heal. And that was not the case. It is a slow heal, but my body was under attack, and my body was under attack for 3 years, and I didn't know it. Now, keep in mind, I worked from home, my home office. I live at home, and we have, well, of course, but I sleep at home, and then I have little kids, so we were at home a lot. But my husband left to go to work, and my children left to go to school. But I was there just slowly breathing this stuff in. And I did have some genetic predisposition to this. And then I was also MTHFR. So I was just like a walking time bomb, really. I was also in a great state of fight or flight for many years, honestly, because my husband was sick and fainting. And I'm like, oh my gosh, what's going to happen to him? I had a high powered job with a lot of pressure. So all of these things were like going into the stew, and then it hit me. And once we put the pieces together, and I'm like, okay, I'm ready to get better. It's 1 month, 2 months, 3 months, and I wasn't getting better. I'm like, but I would have 1 day of relief, and I'd be like, I feel okay again. My pain is minimal. I'm not peeing 60 times a day. But it was 6 bad days and 1 good day. Then about 6 months in, a couple more good days than bad days. And now I am, since healing and being diagnosed and starting my treatment, I am 13 months out, and I have 6 good days and maybe 1 bad day. But I do experience some flares, maybe with exposure or stress. Would love to talk a little bit about the nervous system and fight or flight in just a moment. But it is a slow recovery. And I think it also takes into account how long you've been exposed and the severity, right? Because some people might have a few symptoms that they can manage through, where for me, when it hit hard. I was having stroke-like symptoms and bedridden and urinating up to 60 times a day. Like, I wasn't functioning. I was having serious symptoms. Oftentimes, folks will say to me that that's some of the worst I've seen. But I share all of this because once I got myself out of the moldy environment and I started detoxing, I started to improve and heal. But again, just like the symptoms are multifaceted, healing is multifaceted. So if you could talk to me just a little bit about, once you've diagnosed a patient, what does their road to recovery look like? Do you follow a particular protocol? Do you go with the detox docs plan? Talk to me a little bit about what that looks like in working with you.
Yeah, so my 4 pillars of detox are to protect the body, always protect the body first, to open the detox pathways, to mobilize the toxins, and bind the toxins. So all of those things have to be done in order to heal. So protecting the body is a huge category because that includes starting a healing diet, which is basically going to be anti-inflammatory. And healing diet is huge, very, very important. So low in sugar, low in processed foods, and low in grains, because grains are very high in toxins.
Say that again, please. Say it loud and clear. People do not know that. I had to learn that the hard way.
Yeah, I mean, it's hard because grains are the staple of the American diet. So low in sugar, because mold loves sugar, and sugar is pro-inflammatory. Low in processed foods and low in grains, not just gluten, but especially gluten, but low in other grains as well, especially corn, which is a grain. So high in toxins, very high in toxins, and pro-inflammatory. You don't have to, have celiac to benefit from limiting grains. So, and there are substitutes. So healing diet and getting out of the moldy environment, or limiting exposure as much as possible. Okay, you cannot out supplement your way out of a moldy environment and I don't even do 6-month programs of people who are not taking steps to minimize their exposure, because it's not going to work.
Right.
So to be, honest. So we have to have that in place, minimizing exposure. And nervous system is part of protecting the body, because if your body doesn't feel like it's in a safe place to heal, you also won't heal. And I've had to have that very difficult conversation with a lot of clients as well, because people write that part off
Right.
and think that it's just, you really don't need that. Like, oh, that's some breathing exercise. Like, that's all cute, but like, it doesn't really matter. It actually does. So, keeping your nervous system out of fight or flight, which is also a huge topic. I have a lot of content on it. We probably won't have time to really dive deep into that today, but it's go into it on all my pages and books and things. Because literally, for example, I've had clients message me, oh, I felt, you can feel it when you go out of fight or flight. And you can feel it repeatedly. You can feel, once you get to that awareness of your body, like you can feel that you're tense, and then you feel it like when you relax and you're like not, you're like, okay, I can digest
So
better
well
and
said.
I can like breathe, and I don't feel like I'm, if something like brushes my arm, I'm going to be like jumping,
Yes, I
you
can
know?
literally feel, even now, have one bad day a week. I can literally feel it in my nerves. It's insane. It's the sensation in the tip of my nerves. It's wild.
Yeah. Yeah. No, that's really important that you say that. And it's so true and so important for people to remember. So, yeah, nervous system, diet, environment. And then, I do some sort of protect the body supplements like liver support and things like that, because we need to boost up our body's detox processes, because like I said, we are exposed to so many toxins that we need to be able to keep up with that. And then opening the detox pathways, for example, if you're constipated, you can't heal because you're reabsorbing toxins.
Mhm.
So if you're not having a bowel movement at least once per day, then you are reabsorbing toxins. And so that may kind of resonate with people if you do have constipation, because you might think, oh, yeah, I do feel kind of like foggy when I haven't pooped. It's like that's because you are reabsorbing toxins. And, lymphatic and all of those things are part of detox pathways. And then mobilizing and binding the toxins kind of go together because they have to be balanced. So the
Okay.
toxins that you mobilize have to be bound and taken out of the body, because otherwise they're going to be reabsorbed as well through the enterohepatic circulation. So that just means that toxins, which can be with bile or other things, get reabsorbed and the body recycles bile. And for example, and the toxins are just kind of circulating everywhere, like blood brain barrier, doesn't matter, like toxins go everywhere. So things like exercise, just literally mobilizing, and
Mhm.
sauna, and just getting outside, getting some sunlight. Mold doesn't like light. So anything that you can do to get outside really is helpful, and just breathe in some fresh air. And then, things like glutathione and other supplements help to mobilize the toxins. And then binders, which I know are a different shoemaker protocol versus the natural binders. I tend to do more of the natural binders. Research compilation that I have prepared because of just the binder controversy, I guess.
Right.
People thinking
It really
or
is. Like, what
saying,
kind of binder are you on? What binder do you use?
yeah, like people say, I only use this certain binder and I only use that certain binder. And it's like, well, what I like to do is I like to cycle them, because we have a lot of different toxins in our bodies, because I'm not just helping people with mycotoxins specifically. I'm helping them to detoxify their bodies from all the things. So, we've got microplastics, we've got heavy metals, we've got all of this. So, and mycotoxins are important, but they're not the only thing.
Right.
So I usually cycle them. It's like we may use the bioactive carbons, some of which are systemic binders, like fulvic acid, can even get across the blood-brain barrier, things like that, trace minerals. And then, charcoal is a mainstay. It is great. You don't want to be on it forevermore, but it is wonderful. There's a reason why it's used in the ER for poisonings, because it is so good at just mopping things up.
Yeah.
Even in like a teaspoon of activated charcoal, you get a football field worth of porous surface there microscopically, to just suck stuff up. Really.
Wow.
So there's a lot of different ways in which these binders work. And the really cool thing for people listening, if you're thinking, what am I going to have for dinner tonight? You can actually include some foods that will bind toxins in your diet. For example, cabbage is a binder for toxins. Things like kale are also binders. Ground up seeds, things like flax seeds or chia seeds. Ground up has more surface area, so for binding, but I use a lot of those, especially with kids, because sometimes you want to start with more like the food-based binders, but you can like blend some things into a smoothie and then you are binding toxins. So, we have these natural remedies. And, as an MD, like I used to just rush to the prescription, but
Right.
as since I do functional, I really like to use as much as possible these herbals and supplements because they work with the body better. Prescriptions are designed to disrupt your body. And because they're like a purified, like one specific, molecule, but herbals and like food-based supplements like oil of oregano, for example, antifungal, antimicrobial, is
Wow.
designed to like we're designed to process those
Okay.
well. So it's like much less disruptive to the body. So then we see a lot less side effects. And I do use some herbal antimicrobials normally. Rarely I'll write a prescription, but I rarely do. Normally I'll try to stick with the herbals and rotate those as well to cover all the bases. Yeah.
Where does antifungal, because this is something else that people are like, I don't use them. Oh, I use them. Where do you stand on that?
Oh, over 50% of people have yeast overgrowth. So like candida. So it is not even from just a mold standpoint, but from like a fungal balance standpoint. Even if you're like, well, okay, tell me why you use this exactly for mold, because if I don't have a biofilm in this specific location in my body, then like, why am I even taking this? It's like, if you have any signs of candida overgrowth, it's going to help with that too. And so, and do you have bacterial overgrowth? So
Hmm.
many people I see have some bacterial overgrowth as well. If you, uh, well, so yeast overgrowth, if you've taken any antibiotics,
Right.
practically ever, then candida will very easily take hold. And I have a book on candida too, but so important and it's missed a lot. But so yeah, I do use a lot of herbal antifungals, especially because yeast balance comes up. Like even if it doesn't come up as a primary symptom initially, people like candida takes advantage of a toxic environment on the inside,
Hmm.
just like parasites do. And
Yes.
so even though it's like, okay, well, what's a little, white tongue? Okay, I can deal with that. But like, no, it can be contributing to all the other systemic symptoms. And these herbal antimicrobials help to balance that.
Yeah. Wow. This is remarkable. And I appreciate you talking a little bit about mixing in some of the herbs and food as medicine, especially for children, right? Because I like to be sensitive with them, right? We can't be as aggressive perhaps. And we're treating our little boy now and being mindful, pectin and things like that in order to get him to full wealth or full health, wellness and full health. Talk to me just a little bit about biofilm. You mentioned that. So, where do you pay attention to biofilm? From my perspective, we talk about Marcons, right, in my healing. And that was my first introduction when we put together that, hey, you have mold. The first thing they do is like, we want to look if you have Marcons and biofilm because that can be really hard to get rid of. And is it often found in people suffering from mold illness? What's your take?
Yeah, so Marcons is common, however, it's opportunistic. So, meaning that my take is that if you treat the mold and the accompanying bacteria with it, which can include Marcons, then that is not going to be as much of an issue. And what I find, and that's what I also find in my clients. So people who have been with severe symptoms or who have had this for a long time, yeah, I mean, biofilms, slime layer, protected slime layer, that's what a biofilm is, are going to have all these components. Like it's not just going to be Marcons, but it's going to be, bacteria, other bacteria, as well as a lot of times mold. So I use the herbal like nasal sprays, nasal rinses,
Okay.
things like that, like your Argentin, silver spray, and the xylitol as a biofilm buster, as well as nasal probiotics, things like that to help rebalance the sinuses. But yeah, biofilms can seed the rest of the body. So, sinus component to the regimen is very important
Okay.
because a biofilm in the sinuses, and biofilms can also be in the gut. They can be in the lungs too. It's less common, but you can find biofilms elsewhere too. And they can be like mold can colonize as well the back of the throat commonly, which is related to that globus sensation or feeling like something's always in your throat, like
Hmm.
clearing your throat all the time, which is very common with mold. So you can just have like either the drainage or the inflammation there or actual colonization, like
Wow.
a little biofilm there. So, less common than the inflammatory effects on the body for sure. I think, and when people talk about this, I feel like meaning the SIRS camp and SIRS for people listening is the Shoemaker Protocol camp of people who say like this is what works for mold illness and very like religious about that. And the general mold camp, which is what I am in. I feel like we agree more than people may want to admit. So, because it's like, yes, I talk about these things, but I talk about them in a different way, but
Right.
we're just talking about the same thing, but speaking the slightly different language. So, we all believe that, mold and yeast and bacteria can be in the body in either biofilms or colonizing, but we talk about it in different ways. So I try to kind of bridge that gap.
Yes. Well, I mean, I'm so tickled that you're willing to be on here and share kind of your approach to this because there's lots of options out there, right? And I want people to know that you don't have to do one or the other. You can do there's lots of options out there. So when we look at, okay, we've identified that someone has this, we're going through the treatment. A couple of questions for you in your experience. What is, if there is, a typical healing period? I shared mine, the expectation was 12 to 18 months with the realization that I'm probably always going to have to work on this, right? Now that like the egg cracked open and I got so sick from this, I do feel like, and this is my personal, I'm not a doctor here, like I'm more susceptible to this and it's something I'm going to always have to manage, which I'm down to manage as long as I'm feeling good, right? But what do you typically when you start working with someone time frame? Like what is the shortest you've seen somebody really come to full recovery? What is the longest?
Yeah. So it's widely variable. So I have seen people who had certain, levels of mycotoxins, moderate to high on a few. And then in a 6-month program with me, it's clear. Like there's no toxins there. And that's generally people who haven't had as bad of an exposure or it wasn't as long and didn't maybe have as a lot of underlying medical issues. And then I have worked with people for 18 months or more, and some of whom I still see, like, occasionally follow up even though they're doing much better now, but it can take a really long time, especially if a few factors, like, especially if there's still, like, environmental issues, like, if they have to move, maybe move again because, like, they didn't realize that the place they moved to also had
Right.
mold.
I hear that quite a bit.
It's so terrible when that happens, but it's a big factor in healing because we always have to go back to that. And they're like, "Well, I already moved." And then I say, "Okay, well, did you check the new place, as recommended? And maybe something has come up in the new place." So, just because you move one time,
Does
unfortunately, doesn't mean that you're free from being exposed to mold forever.
Right. Do your due
And
diligence, do the
yeah,
ERMI, do the air test, have someone get in there.
exactly.
Like if you can,
Exactly. Yeah.
we've moved 3 times. There was a water leak. We were about to close and they called us because they knew we'd done all the testing. They're like, we've had a major water leak. How long was it in there? For 2 weeks. Nope, we're not closing, So yes, do your due diligence because I hear time and time again, I moved from a moldy environment into another one.
Yeah, or even the car. Like I had a client, he had to get rid of his car and then he finally started getting better. That story is in my mold book because it's really important. It's something that gets missed. And then, so also, if there's something else going on, like do you have Lyme disease that hasn't been managed? And sometimes that comes up and we have to deal with that. Or that is a layer. Because like as we peel back the layers, sometimes we find things. So, I just like to make sure people know, that I'm with them, for the long haul if needed. And we may discover things along the way.
Wow.
Like, oh, you do have like chronic viral reactivation or like some EBV, or like it can be so many different things, which is why I just encourage people to work with a practitioner because
Right.
it's so much of like so many rabbit holes. You can be up all night, every night, looking down all these rabbit holes. And, spoiler alert, you're never going to find the magic pill for all of your issues.
No.
So it's important to, partner with a practitioner so that you can say, okay, well, I got this realization. I'm just thinking last night or something that, okay, maybe this is related to this. And then you can message them. Like that's what people do to me all the time. And then I'm like, yes, okay, that let's go there, like let's lean into that and maybe, work more on nervous system or whatever. The realization is like, oh, maybe a trauma came up that you realize you hadn't dealt with or things like that. I mean, it's like any of
That
these
creeps
things
back
can
in.
happen. Yeah.
Talking a little bit about managing expectations, what are some of the pitfalls that you see in folks that are like, or common mistakes that you see people that are on this road to mold illness recovery?
Yeah. So I would say missing pieces are often the dietary piece. So people would say, okay, well, I'm like eating healthy, but what does that actually mean? So, really getting into that low toxin dietary piece and then nervous system.
Yeah, so
So,
important.
just to underscore that. And then the gut. So, I really feel like it gets missed by a lot of practitioners. A lot of people do toxins, but they don't do gut, or they do gut, but they don't do toxins, which is why I
They go hand in
do
hand.
both. And that's like my two main, foci in my practice is the gut and toxins because they're so interrelated and it's a huge, huge piece. Like gut healing um is just a major aspect for a lot of people. And then the drainage before detox too. So if you're, no binders if you're bound up. Like that's
Open
one of
up the
my huge
pathways.
exactly.
Okay.
So that's one of the huge, reasons that I don't immediately start with a binder,
If you're
as
blocked.
in the Shoemaker protocol normally would, because, I've had a lot of people come to me and they started with a binder because that was like step two, I guess, was the first step is the environment. But then you have to, start these binders, and sometimes you're not ready for that.
Yeah.
So sometimes it can backfire. Sometimes it is the right thing. Sometimes it's the right way to go. But if you're bound up or if there's lymph issues, then a lot of times you're going to get worse symptoms and you're going to feel even more
Right.
terrible than you already feel.
Yeah, that's a great point. Okay. And then how do you monitor progress, right? So folks are going to come to you and likely do a large workup, find out what we're cooking with. How do you monitor progress?
Yeah. So the biggest thing is the symptoms. So I take like a symptom score every month when people follow up with me and we see their scores for their symptoms. And I love to bring that up because it's like the cold hard data. It's like, well, you were at a 42 symptom score and now you're at a 20. It's like, it's like it's really nice for people to see that because even if you don't feel like you're fully well yet, you can say, oh my gosh, well, my symptom score just cut in half, and I didn't even like realize that. So there's that. And then I do repeat testing usually after about 6 months to make sure that we're on the right track and we're not missing anything.
Okay, so this has been so enlightening. Thank you so much, Diana, for joining us. If someone wanted to start with you, right? They're thinking, I think this is what I have. Where can people find you? And then also, can you talk a little bit? Because, a lot of folks are under the impression that mold can be expensive. And I'm not here to lead anybody into the dark. It can be. Now, look, I'm in sales. I use quite a bit of my commission check to allow me to do these testings and to remediate. Can you give us a kind of a scope maybe about, is it all upfront payment? Is there a payment plan? What does that look like?
Yeah, so I have a ton of resources for people. I have all the way from Like if you want to try to do DIY, you can with like my books or my online courses, which are in my online healing community, which I highly encourage everyone to join. It's in School, that's spelled SKOL. It's the platform for courses. So where you can connect with people going through the same thing. We just set that up and it's just taking off and I'm so excited about it. And to work with me one-on-one, so I do everything over the video and I focus on, we do a video consult, but then I try to work with people for 6 months at least, like in a
Okay.
6-month program. And yeah, we have payment plans and everything like that just to, make it more convenient for people. But definitely, I totally I love what you're saying about, the expectations because yeah, we can't fix 10 years or even a couple years of severe, medical issues in 1 hour.
Right.
So it's so important to continue to follow up and just be partnering with a practitioner and not just like randomly, seeing them one time. So as far as where people can find me, yeah. So all over social media, if you want to watch more of my content, the Detox Doc on all platforms. And then my web is drstafford.com with the doctor spelled out. And that has, my booking calendar and everything. So, and then the school community is called Reclaim Health Hub.
Okay. And we'll make sure that we hyperlink and include all of this in the recap of the podcast so that folks have access to it. But I just want to thank you again. Again, I came across you on social media and the content you were putting out was speaking to me. And I was already healing, but I just think you have such great insight, great resources. And I thank you for the time today, sharing your insight and your expertise. And I look forward to continuing the conversation, sharing your resources, sharing your contact information, and keeping the conversation going as we look to get people to health and wellness quicker.
Katie, thank you so much for having me. It's been a pleasure.
The I Mold You So podcast with Katie Buckland Weiss.